Hi everyone, I am Jason Bautista and I will be reporting Mers-Cov, SARS, and COVID-19, a worldwide pandemic phenomenon. So before we proceed to the lecture proper, I would like to present the objective of this lecture. First, we need to define Mers-Cov, SARS, and COVID-19, create awareness on signs and symptoms of Mers-Cov, SARS, and COVID-19, know the differences of Mers-Cov, SARS, and COVID-19, have knowledge on how to protect our health and the impact of this lecture to the public health. So first disease, we have the Mers-Cov. Mers-Cov or Middle East Respiratory Syndromes is a viral respiratory diseases caused by MERS coronaviruses. Coronaviruses are a large family of virus that causes diseases ranging from common cold to severe acute respiratory syndrome. It is at first identified in Saudi Arabia in 2012 and has 2,519 laboratory confirmed cases with 866 associated deaths. Three or four in every 10 patients infected with MERS-CoV have died due to Middle East respiratory syndromes. The source of virus it is a zoonotic virus transmitted from animal to persons, probably camel to bat, and human infections. The origin of the virus is not fully understood, but according to this study, it is originated from bats and transferred to camel to human. MERS-CoV or Middle East Respiratory Syndrome is transmitted through close contact, caring for person infected with MERS-CoV, providing unprotective care, and also linked to the countries in and near the Arabian Peninsula, and it has recorded a largest known outbreak in the Republic of Korea associated with travel to Arabian Peninsula. So this is the chain of infection, how we get and transfer Middle East respiratory syndrome. First, we have the microorganism. The microorganism causing Middle East respiratory syndrome is the MERS coronavirus. It is reside in a infected persons and it will be come out through respiratory system via eye, mouth, and nose through coughing, sneezing, or have a direct contact. It is transmitted through close or direct contacts and it will enter in a healthy individual through their respiratory system such as their mouth, nose, and eyes, and now the susceptible persons contracted the MERS coronavirus. So the symptoms and complications of Middle East respiratory syndromes before it will undergo 5 or 6 days after the person is exposed, but it can range from 12 to 14 days before the symptoms can be appeared. And most people with confirmed to have Middle East respiratory syndrome infections have severe respiratory illness with symptoms of fever, cough, shortness of breath, and gastrointestinal problems such as vomiting, nausea, and diarrhea, and severe complications like pneumonia, kidney failures with patients with kidney failure with patients with pre-existing conditions such as diabetes, lungs, heart and kidney problems, or persons with decreased immune system. So the treatment of MERS-CoV or Middle East respiratory syndromes is symptomatic treatment, meaning we treat the patients based on the presenting signs and symptoms. There is no specific antiviral treatment for MERS-CoV, and we treat the patients based from the presenting signs and symptoms. Virus will eventually diminish if you have strong immune system. So the preventions of Middle East respiratory syndrome is you need to do hand washing for at least 20 seconds. If soap and water are not available, use hand sanitizers. Cover your nose and mouth with a tissue when you cough and sneeze, then throw the tissue in the trash. Avoid touching your eyes, nose, and mouth with unwashed hands and avoid personal contact such as kissing, sharing of utensils with sick persons of MERS-CoV, and clean and disinfect frequently touched surfaces and objects such as doorknobs. So second, we have the SARS-CoV or the severe acute respiratory syndromes. It is contagious, contagious and fatal respiratory illnesses caused by SARS coronaviruses. It is first identified in 2012 in the province of Guangdong in southern China. It is a zoonotic virus yet to be identified but probably originated from bat then spread to animals such as cat and human infections. So SARS or severe acute respiratory syndromes is transmitted through droplet transmissions. A large respiratory droplet enters the air when someone with SARS cough, sneeze, and talk, and travels less than 3 feet. And it is also transmitted through direct or close contact. A person who have close or direct contact with infected person providing and protective care are at a greater risk in contracting severe acute respiratory syndromes. So again, this is the chain of infection on how we can contract uh, SARS or severe acute respiratory syndrome. So the microorganism causing this disease is the SARS coronavirus, and it resides in the infected persons, and it will come out of the infected persons through respiratory system such as their mouth and nose via droplet transmission such as coughing and sneezing. And it will enter in a healthy individual through also their respiratory systems via their mouth and nose, and now the healthy individual can contracted the virus or the SARS coronavirus. So the symptoms of severe acute respiratory syndromes is you experience flu-like signs and symptoms such as fever, chills, muscle aches, headache, and occasional diarrhea. The signs and symptoms usually begins 2 to 7 days after exposure to SARS coronavirus, and also it can affect the lower respiratory tract system of individuals causing dry cough, dyspnea, progressive hypoxia, and respiratory failure. There is no definitive treatment protocol to SARS coronavirus. Many treatments have been tried proven successful result. And first, the person infected with severe respiratory acute syndromes, the person is placed on isolations and standby mechanical ventilations just in case the virus reach the lower respiratory tract systems of the individuals. And it should be handled with group of experts such as infectious disease specialists, pulmonary specialists, and critical care specialists, and also proper coordinations to health authorities for proper contact tracings and proper treatment of the severe acute respiratory syndromes. So the prevention for severe acute respiratory syndrome is first we need to do hand washing at least 20 seconds, and if you do not have soap and water, at least you can use um, hand sanitizer. Always wear surgical mask, wear disposable gloves, wash personal items, disinfect surfaces, and boost your immune systems by acquiring healthy lifestyle. So last we have the COVID-19 or the novel coronavirus 2019. So COVID-19 is caused by novel coronavirus and first identified and originated in Wuhan in China. It is more transmissible than SARS but less deadly than SARS. There is a high evidence of human to human transmission. Worldwide, we have 4,233,504 confirmed cases of coronavirus and 1,481,314 recovered from the disease and 289,932 confirmed death due to COVID-19. In the Philippines, we have 11,350 confirmed cases of COVID-19 with 2,106 recovered patients and 751 recorded deaths. In Pangasinan, as of May 13, 2020, Pangasinan have 39 confirmed cases, of which 3 is still confined in the hospital, 9 have died, and 27 recovered from COVID-19. COVID-19 is transmitted through droplet transmissions. Droplet meaning the virus carried within droplet emitted from infected persons, and direct and indirect contact. It can also be passed if you have touched secretions from infected persons. There is no evidence suggests that COVID-19 is transmitted through airborne, but also it can transmit through surface contacts. When a person sneezes, cough, the droplet fall into the surfaces of tables and chairs, for examples, and the virus may remain alive for up to few days. When someone else touches the tables and chairs, the virus can be transmitted when he rubs in his eyes, nose without hand washing. And the incubation period of COVID-19 is 2 to 14 days after exposure to COVID-19 virus. So this is also another also the chain of infection. How will you get COVID-19? So the microorganism causing COVID-19 is the novel coronavirus, and it is reside in infected persons, and it will come out on the infected person through their respiratory system such as their mouth and nose, and it will be transferred through droplet transmissions or close and indirect contact, and it will have entered to healthy individual through also to their respiratory system such as their mouth and nose, and now the susceptible or the healthy individual have exposure to COVID-19 patients can be contracted the viruses. So the signs and symptoms of COVID-19 and most infectious diseases when displaying signs and symptoms, they experience runny nose, headache, cough, sore throat, and fever, and feeling of being unwell. The preventions of COVID-19 is, as of today, no current vaccine to treat COVID-19. However, you can reduce the transmissions through hand washing, avoiding touching face and areas, and avoid close contact with person infected with COVID-19. And keep yourself hydrated. Always stay at home and get plenty of rest, at least 8 hours of rest. And contact your healthcare provider if you have concern with your symptoms, or contact your healthcare provider if you believe you have been exposed to the patients or persons have COVID-19. So that's all. I hope you learned from my lecture. Thank you.